Hello everyone, I'm Dr. Ruhland from the St. Paul Pet Hospital. Today I'm going to go over nail trimming very quickly, and I'm going to show everybody where you can appropriately trim a nail and just some anatomy. So I've got Bombay here. She's going to be our model. Bombay is my house dog, so she's here for some work, and hopefully she'll be a nice model for us. The anatomy on a dog's nail, where the nail bed starts out to the tip here, this is the quick area. This is the blood supply. There's a nerve and an artery that comes into the end of there. So if you hit this area, there will be significant amount of blood that comes out of there. So we want to avoid this area at all costs, pretty much from here over. And you can see that little arc of pink. We want to stay away from that. We can cut this nail effectively right about to here, and that should not cause any pain or sensitization at all on Bombay here. But you get any closer than that, that's going to hurt quite a bit. Now on a dog with black nails, sometimes you have to kind of use your imagination and use that natural hook of the nail and sort of identify that. And if you start to trim from the very tip back, you'll start to kind of get to an area where you might just see a little bit of blood. Then you can stop there. Then you kind of know where to go. But if you've got a dog with black nails and you really don't feel comfortable, it might be a better idea having a veterinary professional take a look at them first and trim them so you kind of know how long. Because this quick area is variable for dogs. It's variable, and it gets a little bit longer as they get a little bit older, and with inactivity it'll get a little bit longer as well. If in an emergency situation, if you do cut that quick supply or you cut that blood supply, there are a couple things you can do. You can use cornstarch, or you can use Quick Stop, which is what we have in the hospital, or silver nitrate sticks. These work really good to stop that. We just sort of, you'll just take this powder and you just pack it in the end of the nail when you're done with it. And we like to use in the hospital here, I use these little clippers here, these little caliper style clippers for dogs, and these I use for cats. So for Bombay here, we'll just go ahead and we'll trim the nail, that little tip. Now it's not a lot, it doesn't look like a lot, but it does take some of that edge off of there. And hopefully that helps everybody at home. If you have further questions, you can always contact the hospital, contact St. Paul Pet Hospital, and we can always answer those questions for you. That's it from St. Paul Pet Hospital today. I'm Dr. Ruhland, and I hope to see you around the great city of St. Paul soon. Thank you.